In this lecture, we are going to cover what to do if somebody discloses to you that they are experiencing suicidality, or if you suspect that somebody is feeling suicidal and might harm themselves. If you are concerned that somebody might be suicidal, ask. We have this idea that questioning or talking about suicide is going to make someone more likely to do it. That's not the case. Right? Talking to your friend or family member or student, or if you're on probation, your probationer, right, is going to give you an idea of where they are and allows you to reach out and provide assistance. Now, if you suspect that someone has attempted suicide, you should not leave them alone. You should call 911 or take the individual to a local emergency department. Right? That might require some fast talking. Right? So my dad was suicidal, and I kind of had to go up and take care of him. And we had to make sure that all of his weapons, he was collected knives and swords, and he had some firearms, right? We had to make sure that those were all taken away from him. And I had to do some seriously fast talking to get him to agree to go to the behavioral health unit at the local hospital. Right? It's really important, right, that you talk to people. Right? You can encourage people, your friend or family member, to reach out. Right? So these numbers here, right, are for the Suicide and Crisis Lifeline. You can call 988 or 1-800-273-TALK. There are also specialized resources. So, for example, for young people who are LGBTQ+, the Trevor Project has a specialized hotline. It's really important to advise people to seek treatment, right, and to try to help them with that process, because you are not a substitute for a mental health provider. But, and that was the thing with my dad, right? There was no way we were going to talk him into feeling better, right? We couldn't make him feel better ourselves. Right? He needed the assistance that he received at the behavioral health unit. You can offer to help somebody, right? Because this person might not have the energy or motivation that they need to look for assistance. Negotiating insurance is always a pain in the ass at the best of times. Right? And if you're experiencing depression and high levels of anxiety and you're dealing with suicidality, right, people can use that kind of assistance. It's really important to be respectful and acknowledge the person's feelings. Their emotions and experiences are very real. Right? You might feel upset and angry, and that response is perfectly okay and normal, because it is difficult to understand when somebody is suicidal. Right? But they don't need to hear that anger. Right? They're not trying to make you angry. They're not trying to mess with you. Right? Don't be patronizing or judgmental. Right? This person does not need to hear that things could get worse because they're really bad right now. Right? And hearing how they could get worse is certainly not going to make things any better. Right? You can provide reassurance that things can get better. Right? And big thing, remove potentially dangerous items from their home, like we did with my dad. We removed all of his knives and his swords. We removed his firearms, and we went through and looked for any medications that it was possible he could take and overdose on. I know it's difficult sometimes for people to give those things away, right? But you can impress upon them that this is a temporary thing. Right? Like the coffee shop that's just down the road, right? I think it's going south on 5th, that will hold, right, weapons, particularly firearms, for people while they're experiencing suicidality. Right? This is a temporary thing. Right? You will be able to get them back when you are feeling better. All right. So we had the do's. Right? Let's look at some of the things that we don't want to say to somebody. Okay. So don't say something like, well, you don't mean that. You don't really want to die. Right? Or your life's not that bad. You've got so much to live for. People have problems worse than you and they don't want to die. Well, gee, thanks. That's not super helpful right now. Or telling somebody suicide is cowardly. You can replace these kinds of things that you might want to say in your head. Right? And it's perfectly understandable why you might want to say those. Like, I know when my dad was suicidal, everybody in my family was really sad and angry and frustrated. Keep those thoughts in your head, right? Maybe talk to somebody else about those thoughts. Things that you can say. Thank you for trusting me. I would like to help. Right? Let's think of some ways I could help you. It must be really awful for you right now. Can you tell me about that? You mean so much to me. You're not in this alone. I'm here for you. Right? Or thank you for telling me about this. Do say things like, I care. Right? How can I help? Because this person is at their most alone and isolated in this particular moment. Other things not to say. Do not say, don't do anything stupid. That's never worked with anybody. You just want attention. Definitely don't say that. You're young. You have your whole life ahead of you. Right? Well, when you're feeling suicidal, it sure as hell doesn't seem like it. What about the people you'll leave behind? How could you think of hurting them? Right? Again, this might be something that you're really feeling in your heart and you're feeling kind of frustrated and angry and you don't want this person to be suicidal, right? You want them to think about you, but this is one of those thoughts that should stay inside your head. Or share it with somebody else later on. Do say, I'm worried about you. Let's talk about it. Talk to me. I'm going to listen. Right? I will try to understand if you explain to me. It can get better. I'm going to help you try to find a way because you mean so much to me. Right? Or, it might not seem like it right now. You have people who really do care about you, and we are going to help you get through this. Right? So things that you can say that really demonstrate that there is support, right? And that they are not alone. Right? We don't want to say things that will make people feel isolated or feel shame, right? Because they're already feeling those emotions. Right? So this has just been a brief introduction to how you can respond to somebody, whether it's a friend or a family member, or it is a client, right, later on in your career.